There are three types of pain that we think about when we're evaluating a patient who has any kind of pain evaluation. Let me explain to you what those are, what the implications are for treatment, and hopefully you'll have some benefit from this knowledge. So the first type of pain is the most common pain that people think about. That's called nociceptive pain. That's the pain that's a result of tissue damage or injury or inflammation. So classic would be you get some sort of injury or you've had surgery and that pain is very focal, it's sharp, you know when it started, you know the intensity, you can describe the quality, and it's not diffuse, and that is known as acute pain or nociceptive pain. The next type of pain is neuropathic pain, and that's pain that's a result of either a nerve injury or neuroplastic changes that has happened to a pain pathway. So let me use an analogy. You've heard of Chinese water torture. That's where they drop a droplet of water on your forehead every couple of seconds for 7 days straight, and people would relay that they would feel like their head was exploding by that time that seventh day happened. So what's happening is that anytime you stimulate a pathway over and over and over again, there's three things that happen. The first is that the threshold at which that nerve pain or that nerve pathway fires is lowered. So let's say you have neuropathic pain in your feet. Instead of feeling heat at 105 degrees, that's when it might feel like it's burning, that threshold will lower to 98, and now you feel like it's burning at 98 degrees. The next thing that happens is it fires more intensely. And the third is it fires for longer. So the threshold goes down, it fires more intensely, and it fires for longer. And this can happen to any pain pathway in your body if it's constantly reinforced for whatever reason. So that's what's known as neuropathic pain. And that's basically classic peripheral neuropathy, what I've just described for you. And the third is a mixed package. So you have neuropathic pain and nociceptive pain. And this is the most common thing we see in people that are over 65. They have some level of degenerative changes and inflammation. They also have some degree of neuropathy or nerve dysfunction. And so that has implications for how we treat the individual. It has implications for what we do from a physical therapy side, from a medication side, as well as from a procedural side. So if you're someone like this and you're noticing a mixed bag of symptoms that doesn't follow the classic acute pain situation, you're likely suffering from a mixed situation. So I'd encourage you to see a pain physician, get an evaluation, and then with that, we'll be able to help you understand your issue and allow you to stay as fit and as healthy as possible for many years to come.